Well, hello everybody. My name is Emily Bright with DocStyle.com. I'm hosting this webinar on behalf of DocStyle. Today, we'll share more about minimally invasive decompression surgery. At the end of this presentation, viewers are invited to schedule a remote consultation with a doctor who performs this procedure. We will also be answering questions throughout the webinar to help you learn more. Okay, so let's begin. Minimally invasive decompression surgery has a high success rate. In fact, 90% of patients report good leg pain relief after surgery. So, what is this procedure exactly? Simply put, minimally invasive decompression surgery refers to several surgeries that decompress the spine. These procedures treat spinal compression, which is pressure put on the spinal cord caused by bone fragments, a vertebral fracture, a tumor, abscess, ruptured disc, or lesion. The surgery can greatly reduce pain in the back and neck, as well as pain, tingling, numbness, and spasms that radiate to the arms, legs, hands, and feet. Patients who undergo minimally invasive decompression surgery report better pain relief, faster recovery, and better mobility than alternative procedures. This procedure can relieve pain and other symptoms in the neck, back, arms, and legs. In severe cases, patients with spinal compression may experience mobility issues, including paralysis and problems with their bladder or bowel, which decompression surgery can also help. Minimally invasive decompression surgery is often performed to solve issues associated with degenerative disc disease, arthritis, bulging or herniated discs, collapsed discs, thickened joints, or loosened ligaments. It can also be performed to remove bony growths that narrow the spinal canal and nerve openings. So, how is this procedure done? The surgery isn't a one-size-fits-all. In fact, there are several variations to the surgery depending on the individual complaints and anatomy. It's important to discuss your individual case with your surgeon. Some steps, however, are universal. Step 1. The doctor starts by cleaning the area and putting the patient under general anesthesia. Step 2. The surgeon makes small incisions in the area they will need to operate in order to access the spine. Step 3. Using small instruments, the doctor pushes the muscles aside, avoiding cutting them the way they would in an open procedure, and then addresses the problem causing the pain. Step 4. The patient is closed and wheeled to recovery. Common variations of the procedure include foraminotomy, facet thermal ablation, laminotomy, and discectomy. How long the procedure takes depends on the specifics of each case. However, in general, minimally invasive procedures take significantly less time than an open procedure. After the spine is decompressed, relief to the back and neck are almost immediate. Patients will need some time to heal and for the swelling to go down, but after that, pain relief should be apparent. In most cases, patients are able to go home the same day as the procedure and resume normal activities, including part-time work, in 1 to 2 weeks. While the risks associated with minimally invasive procedures are greatly reduced, every surgery does carry risk. Patients should discuss the likelihood of developing certain post-op conditions with their surgeon. A person's individual health and the specific procedure they undergo can lend to different risks. In general, patients should be aware that this procedure, like many back surgeries, can lead to infection, blood loss, nerve damage, pain at the graft site, blood clots, complications associated with general anesthesia, leaking spinal fluid, or persistent pain post-surgery, also referred to as failed back surgery syndrome. Now let's talk cost. As with any procedure, the cost is dependent on the exact treatment you receive, your doctor, and your insurance. Back surgery in general can be expensive, however, insurance is likely to cover all or part of the procedure as long as it's deemed necessary. Minimally invasive procedures also tend to cost less and don't carry a large hospital bill because there isn't a lengthy stay involved. Laser spine surgeries average $30,000 to $90,000 in general. If you would like to learn more about minimally invasive decompression surgery, click through our offer on the right to schedule an appointment with a doctor who performs this procedure. Thank you for joining us and have a great day.